Pleasure to be here today. And I know that Dr. Schwartz today is going to be talking about synchronicity, so I promise I won't spoil your talk when I mention this, but it's amazing to us when we come here today and we listen, and from the moment we hear the opening ceremony and we, as a medium, we can feel the presence of the spirits and we see the plan and how it just sort of unfolds, and hearing everyone's talk today, it's just proof that the Spirit's influence, they're the guides that really, truly inspire us to prepare our talk today. And it's interesting because our talk today, as we listened to Dr. Petrillo yesterday speak, and he talked about Larry Dossey, but it just so happens that I was inspired to talk about the wife of Larry Dossey and her theory of integral nursing. Her name is Dr. Barbara Dossey, and she will be part of the framework and the modality combined with Spiritism that we will use to share today of how we can approach nursing our way into integrative health. So just a little tidbit. It's very interesting, and I'm very much interested in this idea of synchronicity. We know that nothing's by chance in Spiritism for sure. When we talk about nursing and we talk about integrative health, it's sort of a play on words here, the word nurse, obviously, because we want to show how do we nurse ourselves into this integrative health to be more of an integrative system. Well, let me share with you a true story of an 8-year-old boy. And he goes to the beach with his family, stepmother and father and older sister. And while he's playing in the water, and the stepmother turns her head, and the father at that very second just doesn't happen to be looking, and he drowns and he goes under, and before his parents could realize and get him out and resuscitate him, he drowns and he dies at the age of 8. So of course it's very traumatic for the family, naturally speaking, of course. It's traumatic for anyone. And from an integrative and a spiritist point of view, we look at that and we say, why? Even as human beings, we think, why did that happen? But luckily for us, as Dr. Schwartz and many others have shared with us today, and especially Dr. Schwartz, when you open up your ceremony, when you tell us the spirits really, they care about us, and Spiritism cares and shows us this caring Heavenly Father, Mother, Father, God. And we know that from a Spiritist perspective, we look at this story. It's a true story. It's actually in the book Between Heaven and Earth. And it's about the story of Giulio. It's the case of Giulio. And the story is so profound when you look at it. Because in everyday life, if we see that story on the news, it touches our heart profoundly. And whether or not we can say, well, Kirsten, it's in a book, I'm not Spiritist, how can you tell me that story is true and what I'm about to tell you? I cannot. But like what Dr. Schwartz and many other researchers have shared with us, it's up to us to believe what we're reading or not. But bear with me and let's just listen to the story of Giulio. And it turns out that Giulio, many lifetimes prior, had committed suicide. So he had come back to redeem himself, so to speak. So he came back, had to go through this whole process, and his life plan for many incarnations were already set in motion, were already planned out for him to be that way. He was going to come in that lifetime, die at age 8, and specifically related to the throat chakra, because in a prior incarnation he had taken some type of venom and had drank it, and it had disrupted his throat chakra, or his vital center, as we say in Spiritism. So remember this case today as we share with you. Remember it as we talk about the theory of integral nursing and the modality combined or married with Spiritism, that this case is not unlike many cases that I've seen come through the ER, of very heart-wrenching cases of children and adults, of things that in science we can't explain the whys of life, but only Spiritism comes and comforts us. And one of the things also for us to think about in Spiritism, and we know as many Spiritists are here, but also throughout humanity, people want to be better. Why are we all sitting in this audience? Why do we take a Sunday and a Saturday where we could be out and about in Washington, D.C.? Why are we here? Why is there an integrative medicine convention going on in February that thousands of people go to? Why do people do that? Why does research spend all thousands of dollars in finding out which modalities, what's the better cure? Why? Why does that happen? Well, in Spiritism, we learned that there is an answer to that why. The spirits tell us that unlike the animals, us humans, we have this need to progress. For humans, there is something beyond physical needs, beyond the physiological. I need to eat. I need peace of mind. I need to breathe air. There is this need for us to be better. This is where it drives us. And oftentimes pain is what drives us to want to understand. And today's lecture is not just about Spiritism, modalities, and research, but it's about what is driving us to do all this. Most times it is our pain. And pain gets such a bad rap. It has such a negative connotation. And we go through pain, we don't like it. Where's my aspirin? I want it to go away. Where's my Oxycontin? Not saying that we don't have a right to take our pain medications, but perhaps looking at pain also from a different perspective could also change how we feel about things. So we would be remiss in not mentioning this great mind. As a nurse, I'm standing up here, and perhaps if other nurses, I don't think there's anyone else in here as a nurse, but most people, even in the medical field, know about Florence Nightingale. I will not go into a long history because it's a whole lecture in of itself, but they say, according to, if you read and you study and you research, and Dr. Barbara Dawsey did do extensive research on Florence Nightingale and all of her publications, two of which I quote below. She wrote two essays, which actually she wrote many essays, but one that I'm referring to here is called Sick Nursing and Health Nursing, that she wrote in 1893, and Notes on Nursing, an essay she wrote in 1860. It's interesting, when Nightingale was coming out with her theories and her ideas about changing how we view our patients, it just so happened in that time period in France and in Europe that Kardec happened to be just so happened to be publishing a lot of things at that time where people were incarnating on the earth. It's just interesting that was the same time period where healthcare as we knew it was being revolutionized. She's most well known for when she came in during the Crimean War. She was with the soldiers and helped with basic things like proper hygiene and saved a lot of lives. But she said something very interesting. She's quoted saying many interesting things, but this is more pertinent to our talk today. When she talks about illness as a reparative process, and if we can respectively, wherever she is in the universe, call it a redemptive process, when she says that it is a general principle that all disease at some period or other of its course is more or less a reparative process, and indeed it is, in more ways than one. We start out with this idea of changing our perspective of what illness is about. And when we begin to change our perspective on this, we cease to be a healthcare system that is disease-oriented and more integrative health-oriented, as the whole person and the whole picture is integrated into the picture. It changes. And of course, as we saw Dr. Petrilla mention Socrates, we had to also mention Socrates as well. When he says, if physicians fail in treating most ailments, let me take a step back. For those physicians that are here today who worked in hospitals, there's always this underlying joke between physicians and nurses. So I don't want this misinterpreted as one of those stabs at physicians and nurses. I'm not one of those nurses. I believe we all are a team, and it's necessary to work that way. But nonetheless, Socrates says, if physicians fail in treating most ailments, it is because they treat the body without treating the soul. And since the whole is not in good state, it is impossible for any one part of it to be well. So we think about the case of Giulio. Yes, he passed away. What about his family as a whole? And oftentimes in medicine, our patient comes in, we do our assessment, they have a headache, or they have this, or they have cancer. What are the drugs I need to give them? You're doing okay. Here are the things you have to do. Okay, go. But do we know how their family is coping with that? I do a lot of work in case management. And I always utilize these ideas of integrative medicine. How is your family? How are your interactions with your family? And back and forth, how does your family feel about your illness? How are they coping? So it's important for us to think about this. And also when our patients come in and say, oh, I have this chronic issue or this acute issue, Well, how is your emotional life? Well, my life's a wreck. I can't stand my husband and my kids get on my nerves. And when we ask them, because this is an actual case that I'm case managing currently, and when we ask the patient, well, do you feel that that plays a role in your acute and chronic illnesses? And he said no, he didn't think so. They're completely interdependent of one another. Of course, he didn't use that word. One has nothing to do with the other, when indeed, everything has to do with it, at least to some degree. But what does Spiritism also have to say about it? When we build this framework, we also want to bring together Spiritism and this theory of integral nursing, which we will get into, and the idea of what healing is. So let me bring this definition to you. That's from the American Holistic Nurses Association Scope and Standards of Practice. They define healing as an emergent process of the whole system, bringing together aspects of oneself and the body, mind, emotion, spirit, environment at deeper levels of inner knowing, leading towards integration and balance. Wow, everything is integrated there. Dr. Barbara Dawsey, whose theory of integral nursing I'm going to be utilizing today as one of my modalities, she states this is her definition of healing. It's a process that's inherent in all living things. It may occur with curing of symptoms, but is not synonymous with curing. And we dare say and theorize that healing happens not just in one lifetime. As the story of Giulio, one act he committed 2 lifetimes ago is still reverberating back into his current life and will continue to reverberate in the next couple of lifetimes. So his healing process, at least according to Spiritism, is occurring over many lifetimes because of one act against the divine laws. But one hope we have, one solace we have, is our ability to heal ourselves. And as Dr. Dawsey says, it is inherent. Each one of us has it, and we will go through her modality and see more in depths. But before we go into the depths of integral nursing, let's bring a little bit of Spiritism as well. And one very important fact, when we're dealing with health, we have to, as Lynn had just spoken about, energy fields. And you'll begin to see, I hope, the synchronicity and the obvious signs of how each lecture sort of complements the other one. And it was so well planned out and organized in both realms of life. But the spirits tell us, this is important, the action of spirits upon the spiritual fluids has consequences of crucial and direct importance for incarnates. Incarnates being us, those that are still in the physical body. And you can find this in the Genesis, it's item 16, page 367. And for those of us who don't understand what spiritual fluids are, slight definition here, spiritual fluids, they are one of the states of the universal cosmic fluid. They are also the atmosphere for spirit beings and also the vehicle for thought. They say that spiritual fluids is analogous to what sound is, or what air is for sound. It's analogous to what it is for the spirits. So this is important. How that mechanism, what they're talking about is the mechanism, how that works. And do we know of it? And how do we take that knowledge and utilize it in our private practices or our practices in the hospital, in our offices? Because it's quite significant. These are not our own words. These are the words directly from Kardec and from the enlightened spirits. But they have consequences of crucial and direct importance for us. We're not referring to the spirits in spirit realm and they have their stuff and they go do. It doesn't affect us. This is for us. Because we should understand how illness develops, at least in one respect. In the Genesis, page 370 through 375, you can go and read this yourself as well. And I'm going to show some very technical images, and I hope that they're understandable. This would be the spirit. Each one of us are immortal beings. So respectively, so this would be the spirit. Each one of us has something called a perispirit, or a spiritual body. It has a very specific thing that it does, for lack of a better terminology. It has the ability to expand. It has expansive qualities. And this is a very important small tidbit in understanding how illness forms and understanding fluids. As spirits and as human beings, we know this, that in Spiritism we have continuous thought, unlike animals who don't yet have continuous thought. So we're continuously thinking. I'm thinking about what's happening at the convention, maybe what happened in the previous Obama conventions and what happened yesterday. So we're continuously thinking all the time. Well, what happens with these thoughts? Where do they go? At least in Spiritism, where do they go? What happens to them? Well, remember we discussed about the spiritual fluids and universal cosmic fluid. Spiritual fluids are a state of the universal cosmic fluid. Well, when we're continuously thinking, those thoughts impregnate in the surrounding spiritual fluids. Just that around here. They're in the universe, just right around me. They impregnate. Then, my perispirit receives those impressions. And elsewhere in the Genesis, they talk about the saturation of the perispiritual fluids. This is significant. It seems technical. Why do I need to know this? It is quite important. In the same way that it's important to know how a disease, how cancer reacts in the physical body, pathogenesis, and it's important for us as clinicians to know how that works. This is also equally important. So when my patient's coming in telling me about his life, I can understand and already conceptualize that along with the pathogenesis and the etiologies of disease, I'm also thinking about this because this is a Spiritist medical congress. What happens then once it saturates my perispiritual fluids? Well, these continuous thoughts, if they're evil, and the word evil we don't like too much, it's such a negative connotation, but lower, less evolved thoughts that are very strong actually cause physical disorders. Kardec does not go into what's specifics because that probably would make things too easy for us and then we'd stop doing all the research that we need to do. But he does say it causes physical disorders. But inversely, if we're having good thoughts, it causes a really healthy feeling. I remember so many times I worked with a number of different physicians, one physician in particular, who all his patients, literally every single one that I spoke to, so maybe not all his patients, but all the ones that I spoke to, always said, when I walked in the room, before he said anything, I felt good. I felt whatever ailment I had was at least alleviated, even to some small degree, seeing his smile and his warmness. Well, for years, we wondered why that was. And yes, he was a great physician, wonderful human being, humanitarian, and person in general, in his personal life and also in the practice he worked in, and when he came to the hospital. But we always thought there's something else. There has to be an explanation scientifically and in the Spiritist doctrine, teachings. What is it? And this makes sense, what this is. Because the spirits tell us that we create this sort of spiritual fluids, the ambiance around us. So when we walk into a room or we go to some place, someone's home, and we feel the energy in the room is a little bit off, well, this is the explanation why. And did we know that the negative thoughts of somebody else and the negative ambiance they create can make us ill? So maybe you're thinking, Kirsten, well, how do I protect myself? I mean, that doesn't seem fair. I shouldn't have to pay for the negative thoughts of somebody else. Kardec in the Genesis actually uses the term armor when he says you actually can protect yourself, calling it spiritual armor. That your perispirit, in as much as it could be this accepting, semi-permeable would be the name, spiritual body, it also can be utilized as an armor for ourselves. Well, Kirsten, how does it become an armor? Good question. Through spirit, through prayer, we manifest this positive energy, we higher our vibration. So it creates an actual armor. These are not our words. You can go and read and study, and they tell us that this is what it is. So it's good for us to know. So when we are going specifically to treat our psychiatric patients who we know are very disturbed, we go in and we pray first to create this shield, this armor. It's important, especially as sensitive mediums, if you are a sensitive medium. Whether or not if you are a sensitive medium, you can actually tell, doesn't matter. Because one of the things Joanna Giannis always says, and I believe it's in the book Happy Life, or it could be in Recipes for Peace, and she says, we are influenced by the people around us. And this is the reason why. People influence us, whether we realize it or not. And it's so interesting when you think about, personally, I've always thought why Freud studied the people and the patients he studied and had the kind of life he did. Yet Maslow chose to study, at least for a period, healthy people. He developed Maslow's hierarchy of needs and many other different theories and thoughts, and he seemed more successful, at least in the literature, and slightly happier. And I often wonder, was that because who Freud was surrounded by? And probably there's a plethora of other reasons why Freud was who he was, and as well as Abraham Maslow. It's something for us to think about, that it's a possibility, at least in Spiritist theory, it's a possibility for us to think about. So we get into Dr. Barbara Dossey's theory of integral nursing. Remember, we're building. This is not a lecture, this is a conversation. So we're building these thoughts with Spiritism and Dr. Dossey. Dr. Dossey says, an integral process is defined as a comprehensive way to organize multiple phenomena of human experience and reality from 4 perspectives. So I'm going to read it. If you find yourself confused, we will discuss it. Don't worry. First perspective, she says, she calls it the individual interior, which refers to personal intentional. Second is the individual exterior, collective interior, and the collective exterior. Does that make any logical sense? No, of course it doesn't. But let me break that down for you and give you a really good example that Dr. Dossey actually uses. And she says, imagine yourself, as a clinician, or not, imagine yourself, you have a very ill patient, and perhaps you, the physician, are wheeling them to get a stat CT scan or stat MRI, or perhaps you're the nurse and you're going to push them towards where transportation can meet you and go and take them. But as you're going there, you realize that transportation, 3 people called out sick, so you have to wait. Your very ill patient, who could be very well having a stroke, has to wait to have a stat CT. And believe it or not, I've seen this happen in the hospitals, I had to say. So you're there, and you're frustrated and you're angry. So this is the suggestion. This is the theory. Dr. Dossey says, in that moment, you have a choice. You can stay angry, of course, but she suggests the following. She says, in that moment, mentally and emotionally, tell yourself, let me calm down for a second. She even recommends using a guided imagery, which others call visualizations, if you know any. If not, there's some great CDs to buy here today, and you can begin training how to do this. In a matter of a few seconds, you can calm down yourself. And that's when she says, and she refers to, I like the pointer works, the individual interior, because you are calming yourself down, and the individual exterior is addressed because you become calmer. Okay, let me relax a minute here. Getting stressed is not going to help the situation. It's not going to get anyone here any faster. My patient's before my eyes is having a stroke, and I can either begin to freak and be upset, or I can calm myself. This also addresses the collective interior, and what she means by that is, by being calm and becoming physically calm, I'm also displaying that to my patient. Can you imagine having some type of ailment where you're in extreme amount of pain, or you feel yourself begin to become extremely ill, and you look up at your nurse or health caretaker, your physician, and they're angry, or they're in some non-calm way, that's not calming for us. That doesn't help us as patients. Doesn't make us feel good. In that moment, we want comfort because we're vulnerable. Our patients are vulnerable. So it's a responsibility we have. So also in that idea, Dr. Dawsey says, we also are addressing the collective exterior, which means I'm also saying, you know what? I'm sure radiology, it's not their fault. It's not the transportation's fault for all the people who called out. So what winds up happening, and if you think about how illness forms, when we think about what we just shared about the expansion of the paraspirit and how thoughts are manifest in our paraspiritual body and they can cause illness, I'm thinking about what negative thoughts I'm sending out to the radiology team and the transportation team. If I'm doing the opposite, I'm helping energetically, and I'm also helping my patient energetically. Can you imagine if I'm emanating all these negative thoughts? Is that helping my patient who's going through a stroke? It's not. Do we become frustrated as practitioners? Of course we do. But it's a matter of practice. But Dr. Dawsey's theory is so amazing that as we studied it and read it, we asked ourselves, had she read Spiritism? Did she read something? And in fact, when you read about her biography, her background, she actually did study alternative medicines for a long period of time of all different sorts. So it's quite possible, but it's more likely that she studied more of Buddhist background and things of that nature. But it's very much in alignment with Spiritist theory. But we have to say a little sidebar here. Because perhaps some of us are thinking, Kirsten, do I have to do all these visualizations all the time? Do I have to be meditating like a yogi all the time? Is that what I'm supposed to be doing? In the Spirits book, they address meditation. They address this idea. They say in question 657, that God wants men and women to think divine thoughts. So God wants us to think positive things, but not for them to do nothing except think divine thoughts. God will ask them to account for the good they did not do. In actuality, we get accounted for the good we didn't do, the evil that happened, from the good we didn't do. So it's things for us to think about. We actually have a responsibility as healthcare practitioners, but as people in general. And just as a sidebar, it's not that he wants us to go and be in our office all day long, just meditating. We actually have to put things into practice. We actually do need to be amongst one another. It's something that I'll address a little bit later, but this idea that Spiritism talks about in part 3 of the Spirits book, the divine natural laws, that the law of society, the necessity that we have to be around one another is actually really important. There's actually some research and data about plants, actually, and actually humans as well, but specifically plants do better when they're together. And when we are together, we push one another to be better. We'll address this a little bit later as well. We understand this framework. Let's go in a little bit to Dr. Dawsey's framework when she talks about the theory of integral nursing. She says, an integral understanding recognizes the individual as an energy field, connected to the energy fields of others, continuously interacting with changing variables that can lead to greater complexity and order. And she says a whole lot of other things, but we just wanted to share that little snippet. Wow, that's fascinating, because Spiritism says that. And consequently, Lynn just happened to mention it, about the energy fields. We are constantly in each other's energy fields, affecting one another, being in this room with these uplifting thoughts about health. How do we get better? What do we do? How do we better ourselves? And we are immersed in this idea of health. This is good. This is good for us. It's good to come to these congresses from a spiritual perspective. We're immersed in this sea. This is a nurse, a researcher. She does have her PhD. We're all calling her doctor here. And Spiritism does back that up. When it says in the Genesis that everything in the universe is connected. everything forms a chain, everything is subject to the grand and harmonious law of unity, from the most physically dense to the most spiritually purified. It almost touches a little bit on that idea of 6 degrees of separation. We're all connected somehow. You know somebody who knows somebody, but we are all connected somehow. So when we read about Dr. Dawsey, and even Larry Dawsey, and theories like that, it bridges so well with Spiritism. And we couldn't help but think about Kardec when he's talked about the universality of these teachings being everywhere, not just in Spiritism, but they're everywhere. And time again, when we read, we're open-minded about reading about this theory and this other religion, we begin to make the connections. And what Kardec said in 1850s and 60s and 70s, it's still true today. We see the universality, especially when we study Dr. Dawsey's theories. She goes on to say that emotions and purpose are parts of the human spirit that can literally leave, quote, tracks in the body. And she talks about this, how our catecholamines, all of our adrenaline just courses through our veins, through different systems, our endocrine system, our immune system, and how it affects it. And she also says that if you trace the anatomic locations from the limbic system down the nerve pathways into the extremities and organs, the physiological changes in the brain correlate with emotions, attitudes, and thoughts. Okay, so layman's terms, what does that mean? My emotions, how I'm feeling, manifest in my physical body. We said that earlier about Kardec. So it matches so beautifully with what she says, the theory of integral nursing, that everything is connected. And Spiritism explains even further. Science reaches a point, and then Spiritism continues its sentence. In the book Missionaries of the Light, there's a mentor named Alexander. He says the following: the pathogenesis of the soul manifests in many different heart-rendering ways. Anger, intemperance, sexual dissipation, and varying degrees of degradations produce inferior creations that deeply affect one's inner life. That's what Dr. Dawsey is talking about. We're just saying it in different words, or rather, Alexander is saying it in different words here. And he goes on to say that a sick body almost always, not always, but almost always indicates a diseased mind. When this mold is affected in its structure by the blows of inferior vibrations, the vessel immediately reflects it. The vessel being our physical body. So as a healthcare practitioner, studying all the theories in nursing and medicine, and then we go and we study this book, it blows our mind. That for us, at least as Spiritists, this is a verification that science and medicine and spirituality, religion respectively, is married in this sense, at least for us. Perhaps science is still on its way, but we're getting there. Let us bring to you a case. It's the case of Antonio in this book, Missionaries of the Light. He's about a 70 or so year old man, and he is widowed. He has a couple of kids that are relatively in their older age, maybe in their 20s, it's not so old. They live at home with him. Antonio is an excessive worrier. He worries about a lot of things. Perhaps maybe it's the age, he's getting closer, he has some intuition, he knows his time is near. He's concerned about family things. But this excessive worry, as we will illustrate, makes him very ill. So much so that it causes a clot to form in the artery in his brain. And as his deceased mother asks for help from Mentor Alexander, Alexander comes, they give him spiritual help, and then Mentor Alexander, when the patient is in a semi-comatose state, talks to the patient. who's incarnate still, and says to him, Antonio, you have been harmed by your own thoughts because of an unjustifiable conflict. Your excessive worries have created elements of cerebral disorganization. Strengthen your desire to gain control over your physical selves while we get ready to help you. You can go and read about this particular case. They go actually much more into depth about the physical assessments. But it's interesting for us to think about that not only do the spirits come and help us, but also we need to make an effort to help ourselves as well. There's another helper that day that also comes, and he says the following, explaining to Andrea Louise about illness, and consequently to us, that relentless disease weakens the lowest instincts and attenuates the strongest flames of the lower passions. Pain slowly tears down the heavy walls of indifference, crystallized selfishness, and excessive pride. It's giving pain a new perspective. Pain ceases to be something negative, it's something we want to get rid of and not feel and be afraid of and hate. And it turns into a tool for us to understand the healing happens over a period of time with understanding of how we found ourselves in that position. Food for thought. Nothing's by chance. We know that. And it's so interesting as we were bringing this quote. At first we weren't sure, but then we got confirmation. We see Claudia Petrillo, and everyone here, I hate to keep just pointing out one person, but talking about rehabilitation, just so happened to be two rehab doctors here, and many other physicians of great importance as well, and everyone here is important. In the Genesis, Kardec says the following, thought is an emission that causes a real loss of spiritual fluids, and consequently, physical fluids, in such a way that persons need to re-strengthen themselves in the emanations they receive from the outside. We all need a little bit of rehabilitation. We all need some time to regenerate ourselves. But oftentimes when we're depressed, when we're sad, it seems as though some people like to segregate themselves. And that's not what we should be doing. It's counterintuitive. We need to be amongst others that desire our health, amongst others that can assist us, or just amongst others in general to assist us, to replenish our fluids. That is why that idea of when the physician I mentioned earlier, when the patients who felt ill, when they walked into the physician's office, they felt immediately better because according to Spiritist theory and thought and teachings, they were actually being replenished. Dr. Stephen Post, probably most of you have heard about him or not, he did a lot of research about the benefits, the physical benefits of volunteering. And this quote from the Genesis, this thought, this idea, it's a verification, at least in part, as to why volunteering is good for us, because we also are being replenished by others' fluids, and they're being replenished by ours. That's why the idea of healing touch and healing helps. We're replenishing fluids. We could not go away without ending with some thoughts and also some tips from Dr. Dawsey. Naturally, she's more geared towards nurses, but this is applicable for all of us. And she says, as the nurse discovers her or his own innate healing from within, one is able to model self-care. What does that mean? We already know, as we shared earlier, we have the healing capacity to help ourselves. But once we learn and put that into practice, we can share that with others. And that's why also, yesterday's lecture, when Dr. Petrillo was sharing the story about his son and how his wife, also a physician, had helped her patient by sharing her story because she, if I may respectfully say this, has dealt with it well and wanted to share that. We can share with others by modeling that, saying, hey, I've gone through something difficult. It will be okay. But we want to share some tips as healthcare practitioners, but as everyday people as well. And this is according to a publication in a Journal of Nursing Education, Teaching Spiritual Care in Public Institution, Legal Implications, Standards of Practice, and Ethical Obligations. The recommendation is the following: self-evaluation of one's own spiritual and religious views. How do I feel about my religion? Evaluate it. Because there are Catholics that consider this, I'm Catholics, but only go one day a week, or not even once a year. And that's okay, it's not bad nor good, just an evaluation. Spiritists or not, how do I feel about religion, spirituality, death and dying, in the afterlife? Perhaps we think we know, but it wouldn't hurt to ask ourselves that question again. And how will that affect how I care for my patient? And will the beliefs of your patient, my patient, or friend, a loved one, affect how we treat them? It's important for us to know these things and talk to our patient to actually make an assessment of their spiritual needs. And there actually is research on the necessity to assess our patient's spiritual needs and what they are. And also, in our everyday life, using Barbara Dossey's idea of integral nursing, each one of us can work on our own selves on a day-to-day basis, identifying one or two areas that we struggle with and work on them daily. Joanna DeAngelis also recommends this, to work on ourselves daily. And also, in alignment with the Spiritist thought about spiritual fluids, we should feed ourselves also positive and uplifting resources, books, movies, TV shows, Spiritist medical congresses. Utilize meditation and guided imagery. There's some great CDs, I don't know if they're sold out yet, on meditation. If you don't know how to, come talk to us later and we can talk to you about it. Also, you can YouTube it and practice it. And again, we have to use Joanna DeAngelis, the spirit guide of the Brazilian medium, Divaldo Franco, and she tells us to keep a diary of our everyday occurrences to track our progress, keep a diary of our emotions to help us really see our progress. We talk about research and we follow data. Do we do it with ourselves? Do we know how we are doing? Give it a try. It really wouldn't hurt. And if it works, you can share with others. You can share with your patients. You can share with your sister. And know that hope and possibility of healing, self-healing, not cure, is always there within us. And know that it has been a great journey researching and studying and being alongside my colleagues today. I've truly learned a lot and wanted to thank each one of you for sharing your spiritual fluids with me. Thank you.